Hi everybody, this is my son Hamilton. He looks pretty chill down here, and he's going to help us show Mommy and Daddy how to do the exercises after the tongue tie release procedure in our office. Hamilton was born with a tongue tie, and we released him a few months ago, and he's volunteered to show you what we do afterwards to make sure these things don't reattach. Now, the point of this is really to make it a game. Babies do much better when it's a game. It's nice, it's fun, and it's pleasant. Now, it doesn't matter where you do these moves, whether you do them skin to skin with the baby, in a rocking chair, or on a change table like Hamilton and I here. You may want to sing or hum to the baby. You can tickle the baby. It's really up to you, but you want to make sure the experience is fun. You know that this is going to be, to some degree, painful for the baby when we're doing these exercises, and the baby won't like it when you're stretching the wound. But that's what we need to do to make sure that it doesn't reattach. So we're going to go over a few different things that we like to do just to make this easy as possible for everyone. An idea here is that you want to get ahead of the pain, not behind it, so you're going to anticipate it. The idea is to make it random. Don't do it always before or after a feeding, because you're going to end up connecting it or anticipating something like this is going to happen. The same thing goes with skin to skin or changing a diaper. It's best to be random. And I get a lot of questions also about doing this kind of thing at night. If your baby's sleeping, you may or may not want to do this. However, I get lots of parents telling me that it's the easiest time to get this done for the babies, and sometimes they don't even wake up. It's an option to keep open. I don't want you to wake up in the middle of the night to do it, but if the baby is sleeping, it may be an idea to make good use of that time. This is how I'm going to do it. We're going to try and encourage his tongue to move, and that's the name of this game here. So what we want to do is we want to get him to move his tongue around his mouth. So I'm going to touch just in here. You can see his tongue already engaging and moving around. So we want him to get used to that and feel comfortable with that feeling. Beep, bop, boop. Yeah. We want to do the tongue lateralization exercises next. So what we want to do is I'm going to put my finger in his mouth and move it side to side along the gums. He's going to chase me around, kind of like what we did in the first place here. So get him this way. And he's going to chase me around. Right. It's nice and gentle. Right. And then we're going to do a little suck-swallow training. So typically these babies, when they're born, their tongue isn't able to get onto the roof of their mouth, and they tend to have a gag reflex. And we want to try and desensitize that and get them used to having their tongue or food on the roof of their mouth. So what I'm going to do is just take my pinky finger, I'm going to put it on the roof of his mouth, I'm just going to rub it on there, and he's going to suck on it. Yep. Just like that. You can see his tongue's moving quite a bit here. Then we're going to go back and we're going to rub the gums in the area. Again, we're going to be playing a little bit of chase, but then we're going to get closer to where the wound is. We're going to gently stretch the wound. A little up and down, a little side to side. So we'll start the same kind of way. We're going around his mouth, like this. But then this is where the tongue tie is right underneath here. So we're going to lift it a little bit that way, a little this way, a little that way. So I'm right under the floor of his mouth. Sometimes it's tricky to see down here, but I'm down in this area now. Not on the gum pads here, but just underneath the tongue. So you can see Hamilton, when we did his, he had a tongue tie, but now he doesn't. Right, that's all gone. It's healed really, really nicely for him. You can see he can really move it. One thing you parents should remember is that you shouldn't be anxious when you're doing this. I know it's normal to be nervous when you start touching the baby and they cry, but babies are going to pick up on that. They're going to know that it's a little bit more of a tense situation. If you do find yourself feeling anxious, you may want to take a minute just to collect yourself and go into the room calm, and that way the baby won't pick up on your own anxiety. In terms of how long do we do this for, we want to do this for 6 weeks. That's about the time it's going to take for the tissues to mature from the immature wound to the mature normalized tissue. The other number is how many times a day do we do it? We're going to do it 6 times a day. Initially, this wound is going to be a whitish to yellow color the day or two after we've done it. Over time, it's going to start to turn more of a red color. Don't stop there at red. Keep going until it looks pink, just like the rest of the tissues there. Now, not all babies are going to be as chill as Hamilton. And you may give you some resistance to doing these exercises, but we have to remember why we're doing these things. We're doing this to be sure that the baby's tongue tie doesn't reattach, and we don't have to put them through a procedure again in order for this to work. Also, when we're talking about the lip, one last thing I just want to bring up here. If we do a lip tie for your baby, you want to get up underneath here and just give it a little lift, just like that, or like that, just like that. So that way that wound won't reattach either. So Hamilton didn't have that done. But that's all we really want to do is just encourage it to move. You can rub it a little bit there, side to side, just to get it to move around. And that's all you really need to do. You're going to find the babies start enjoying these exercises because the increased movement of their tongues. And that's really what it's all about, is to teach that tongue to start moving forward. So everyone enjoy, put the baby to breast as much as possible, and good luck.